Hey everyone, this is Libertarian Black Man. It's been a while since I've released a video, but I do want to get back into sending out the message of why bigger government is the worst thing for our country. So one of the things that government influences is the price of goods and services, and what happens to prices is based on not just supply and demand in the marketplace, but also government influence on supply and demand. So in short, governments, whether they are federal, state, or local, manipulate the prices of goods and services by regulating or restricting their production and by subsidizing or financing their consumption. So in a free and competitive market, what you have is a lack of government influence through subsidies, through regulations, and you have enterprises, businesses becoming more efficient. Prices fall because they are producing more goods at lower costs. Prices fall, access to products rise because people who don't have as much income can afford those products as a result of prices coming down. One example of this is what happened with Apple's iPhone X. Back in 2017, the iPhone X was released and the price was $1,000, which was the most expensive iPhone ever produced by Apple, and they had been making them since 2007. So on the 10th anniversary, they produced the most expensive iPhone at $1,000. But look at what happened only a few months later. As of March of 2019, the iPhone X was marked down 25%. You could go to Best Buy and get this phone for $750. Only a few months later, because in fact it was released in late 2017, and here we are, early 2019, the iPhone is now a quarter of what it cost only a few months earlier. This is due to Apple's ability to become more productive and efficient in the production of iPhones, constantly innovating, constantly making better devices at a lower cost, and having produced so many of them, they can mark the price down. Unfortunately, we have become more of a government-regulated and government-subsidized economy. And in this type of market, enterprises become less efficient because of rising costs due to government regulating production and subsidizing the consumption, subsidizing consumers by giving them money through loans or some kind of program to buy goods, and as a result, prices rise. When prices rise, access to products falls because they get more expensive. If you're someone who's dependent on a $20,000 a year income and it's a fixed income, you're not going to want prices to rise because your income is fixed, and it will only be a matter of time before you cannot afford the goods and services that you were able to afford as a result of rising prices. So access is limited as a result of rising prices, limited to the poor in particular because they can least afford to absorb the cost of inflation. Perfect example of this is health insurance plans. Unlike the iPhone X, which saw a 25% drop over the last 1 to 2 years in its costs, health plans are seeing a 25% increase. This is a story that came out back in 2018. New York Times and every media organization reports that health plan costs are growing by an average of 25%, but there are different averages, different estimates. Some of them are saying that healthcare premiums for 2018, which has come and gone, but could go up as much as 50%. 2019, 2020, 2021, and so on does not look to be any different than what we've been seeing over the last several generations. The cost of healthcare rising and rising as a result of so many things that government has done to intervene in the healthcare market. A perfect example, well, we've got 5 of them. licensing laws. For example, 4 years of undergraduate, 4 years of graduate, and 3 to 7 years of residency training being required before you are even allowed to legally enter the medical profession as a doctor. Then you have health boards that were set up, which are government officials and industry insiders sitting on panels approving hospital construction, for example, or the construction of a medical facility. Then you have restrictions on imports, import restrictions such as the FDA banning foreign prescriptions, because in fact the FDA is run by pharmaceutical industry insiders who sit on FDA boards and panels who decide whether or not foreign drugs can be allowed to come into the United States. They claim it's a safety issue and therefore we can't trust foreign imports, so we want to keep the public safe from what the foreign drugs may be made with, and therefore we can't let them in the country. But that's the oldest excuse in the book. Really, the reason the FDA does not want foreign drugs coming in is because it competes with pharmaceutical industries here in America. It's that simple. They'll never say that because that would give away the agenda. But in fact, bans on imports are about restricting competition against domestic enterprises instead of keeping the public safe. Drug prohibitions. The Controlled Substances Act, which was enacted back in 1970, which prohibits the use of natural substances that you can grow here in America, or importing natural substances like opium and coca and marijuana and many other products. Once again, these things compete with prescriptions produced by the pharmaceutical industry, and as a result, they're not allowing it to come into the country. It's just a ban on competition. It's not about public safety whatsoever. And then you have subsidy programs. For example, Medicaid, Medicare, Obamacare, and then state and local government programs designed to pay for people's health insurance, pay for people's health care, whether it's for people who are in old age or people who are poor or people who are in a certain situation. Government subsidizes the consumption of healthcare services, and as a result, the prices rise because the healthcare providers are simply catching all of the money that the government is pouring into them by raising prices. When you subsidize something, you get more of it. If prices rise and you subsidize it, guess what? It will rise again, and then it will be subsidized again, and then it will rise again, and the cycle will continue until something changes in that cycle. We don't subsidize the consumption of iPhones. So as a result, Apple had to become more efficient in the production of iPhones so that the price could come down and become more affordable for people. At the same time, we don't restrict the production of iPhones. We don't require anyone to go to a special school, get a special license or certification before they can work in the production of making an iPhone, or get employed by Apple or by Samsung or by anyone who makes smartphones. So there's a big difference between how we do things in a market where the government is not involved versus how we do things in a market where the government is involved. As soon as we understand the difference, we are going to pull the government out of the healthcare market. We are going to abolish these programs. We're going to cut off funds to we're going to cut off funds to people who are consuming these services, and we're going to allow the marketplace to turn out these services in a much more efficient way. Thanks for watching. Please subscribe to Libertarian Black Man on YouTube and follow us on Twitter at Libertarian Black Man, and we hope to see you in the next video.